Mental health care is health care. We must fulfill the promise of true mental health parity for all Americans. Now.
President Biden is proposing some big changes to help solve a major problem, a lack of access to mental health care. The numbers are pretty striking. According to a 2020 study by the Substance Abuse and Mental Health Services Administration, just over 1 in 5 American adults are dealing with mental illness, and of those, less than half received care. This need is even more pronounced here in Florida. According to Mental Health America in 2022, there were over 2.9 million adults dealing with a mental illness here and another million plus with a substance use disorder, all while ranking 49th in the country when it comes to access to care. Lauren?
Yeah, Jameson. So with all of this in mind, we wanted to go beyond the headline and learn more about the impact national changes could have. Tonight, ABC Action News reporter Lydia Vasquez speaks with a licensed mental health counselor about what this could all mean and how the lack of access to mental health care is impacting people every day.
For me, it's a win.
Natasha Pierre was diagnosed with bipolar disorder more than 20 years ago. She tells me she often fell through the cracks between insurance companies and getting the mental health help she needs.
But I've experienced where I was only able to see my therapist and psychiatrist once per week. And if you are in crisis, if you're in need of that extra support, mental health providers shouldn't have their hands tied with how much care they're able to provide.
But Sandra Seeger, licensed mental health counselor, says her hands are tied. She says she was forced to stop accepting patients with insurance.
I stopped taking it because we would not get paid. I would submit a bill, and because I didn't do something specific on it, they wouldn't pay me. So I might be out $500 or $600 and I'd never get it back.
Tuesday, President Biden announced plans to push insurers to increase their mental health coverage and to treat mental health care like physical health care.
Our plans would require health insurance plans to identify the gaps in the mental health care that they provide.
Those gaps include measuring how many mental health providers are in their networks, how much they are paying these providers, how difficult it is for someone to join their network, and how often they require prior authorization and deny those requests.
If the insurance companies are getting better about paying and are paying more reasonable rates and getting better about paying on time, I think there's a lot of us who would reconsider taking on insurance again so people could use their benefits.
We reached out to Representative Kathy Castor. She's a member of the Subcommittee on Health, who tells me her office plans to work with agencies enforcing this. She also says she's introduced a bill to put more mental health counselors in schools.
Children are 6 times more likely to get the mental health care that they need in the school setting. That way you're not having to fight to find that psychologist in your neighborhood or work through your primary care doctor or pediatrician.
Meanwhile, Pierre tells me she was able to find a psychiatrist to work with, and she hopes these new rules will make mental health help more accessible for others.
I don't want to be the exception. My experience should be the rule. Me being able to have access to 3.5 months of a program that changed my life, I shouldn't be the exception.
In Tampa, Lydia Vasquez, ABC Action News.
And if you or someone you know is struggling with their mental health, there is help available right now. You can dial 988 anytime to speak with someone who can talk to you and connect you to resources near you. Also, here at ABC Action News, we are committed to making sure everyone is informed about the resources in the Tampa Bay area, as well as giving people a space to tell their stories of hope. You can find all of that on our website, abcactionnews.com/notalone.